helping make your life easier. Moms Every Day.
Hi, welcome to Moms Every Day. I'm Patty Cheek. Viorel Raducan joins me today. And, you know, as moms, you may have to use your services. You may need a pediatric orthopedist. Now, he's from Cabell Huntington Hospital. And
yes.
What is it exactly that you do?
Well, we do children orthopedics.
Right.
Meaning that we look pretty much at anything and everything about problems with children's bones and joints.
Right. And you never know. That could definitely come up with your kids.
It does.
What kinds of things do you see a lot?
Well, I think the bulk would be children's fractures.
Okay.
Children are active, they do sports, so they do break bones, which makes a big part. But also we deal with more complex problems such as scoliosis.
Right.
And other spinal deformities. Scoliosis is the most common.
Scoliosis the most common?
Well, I wouldn't say, it's probably the best known as far as spinal, what we call deformity. And also deal with something more complex, such as children with neuromuscular disease, which can impact the child's skeleton in all sorts of ways, and we try to make it better. We deal with congenital malformation, like, you know, hip dysplasia, commonly known as congenital hip dislocation. The spectrum is larger, but that's probably the most common. Muscular dystrophy, and
is there anything that you see that is just so high right now? What you see? What's the most common? You said scoliosis, pretty much, or?
I think it's best known as far as children orthopedics. Probably the most commons are broken bones, because they're out there roughhousing and falling off of the tree house and everything like that. Yes, they do.
All right. And so, you know, when you need to go see an orthopedist, is it better to go to a pediatric one if it is a child versus general?
The difference would be that we as pediatric orthopedic surgeons concentrate on children. So we focus on them, we see the numbers, and also not uncommonly we look at something that looks trivial, and all of a sudden, because we specialize and we focus on it, we find out that there's something that we may need to dwell into a bit deeper.
Well, again, how do you treat things?
The difference between adult and pediatric orthopedics is that children have this amazing characteristic: they grow.
Yeah, it's an amazing
thing. It is an evolving situation. Children bones grow. They have these special areas at the end of each bone, roughly, called growth plates. So when we look at a child, we don't look at it like a static picture in time.
Right.
We look at, number one, we need to treat it in a way that will prevent problems with further growth, eventually harness best growth potential possible. And we need to find out that if the child is 5, that child will likely have a long and productive life. So that's probably the focus. And usually there is a difference in way, like fractures. We treat fractures in children compared to adults. It's the main focus that we treat in a way that will allow the best outcome in terms of growth and function.
Now, is what you do common or is it rare?
There are lots of children. I think pediatric orthopedics is a well-known subspecialty. Our numbers are not very high, though. We tend to be concentrated in larger areas, in large children's hospital. Yeah. So quite often, if you're not close to a metropolitan area, you have to travel a lot to get to a pediatric orthopedic surgeon or other pediatric subspecialties.
And now it's my understanding that when you do what you do, you typically have more of a niche that you deal with. You don't deal with everything else. Is that right?
Usually we are trained to deal with pretty much everything. Right. But by circumstances or likes or all of a sudden you're faced with a problem that's common in a certain area, you develop that particular interest and you're obviously going to be more versed into dealing with it.
And what do you like to stick with?
I like to stick with scoliosis.
Scoliosis? Yes. Is it more common in boys or girls? Does it matter?
Well, it really depends. Scoliosis is a huge subject in of itself. But I think the commonest variety of scoliosis, which happens in teenagers, for some reason, seems to be more common in girls.
In girls?
Yes, and it is interesting because it's not like the scoliosis is more common, but scoliosis that actually needs treatment.
Okay.
Seems to be more common in teenage girls than teenage boys.
All right, well, that's something to think about, moms. If your girl's going to be a teenager pretty soon, and if she has any pain, anything going on, it could be an issue. You might have to come see Dr. V over here. Well, thank you so much for joining us today. We really appreciate your insight.
I appreciate it also.
You can just head to WSAZ.com. Make sure you click on the Moms Everyday tab. You can rewatch this interview and find out all that good stuff. Make sure you download our app as well. We will be right back after the break. Stick around.